Now, is Santa Pasha Augustus and is Dr. Spa or Dr. SPA?
It's Sana Pasha Augustus
Now,
and
is Santa
Spa.
Pasha Augustus and is Dr.
Spa.
Spa or
So
Dr.
yeah,
SPA?
it's spa. My
It's
practice is spa.
Sana, Sana Pasha Augustus.
Now,
And
is Santa
Spa.
Pasha Augustus and is Dr.
Spa.
Spa or
So
Dr.
yeah,
SPA?
it's spa. My
It's
practice is spa.
Sana Pasha.
Uh-oh, wait.
Now, is Santa Pasha Augustus
Is there
and is
something?
Dr.
Spa.
Spa or SPA?
Give me is
Wait,
something
what's happening?
repeating?
Spa. My practice is spa.
Something is
Sana Pasha.
Uh-oh, wait.
Now, is Santa Pasha Augustus and is
Something.
Dr. Spa or
Give
SPA?
me is
Wait,
something.
what's happening?
Ooh,
Am I good
I
now?
think that's good now. Yeah, because I think it was on
Yeah,
some
I
type
don't
of
know. I
some
don't
type
know
of
what
loop.
that was. I don't
Yeah, it was like looping.
yeah, I was like, this is weird. Got a little weird.
So Sana Pasha Augustus and it's Dr. Spa.
Yeah, right, exactly.
Sana. Okay, gotcha. Okay. Well, I'm ready when you are, Dr. Kimmy. You let me know.
Oh, you are good to go. We are live.
Awesome. Good evening, everyone. This is Dr. Dondre Simpson, president of the Howard University College of Dentistry Alumni Association, HUCDAA, as we now are known for. I want to welcome you to our highlighted alumni exchange series, where we as HUCDAA are starting to focus more on you alumni, which is kind of what the Alumni Association is. So we want to welcome you March 24th, 2025. Tonight, we're going to be highlighting one of our beloved own, Dr. Sana Pasha Augustus, affectionately known as Dr. Spa. She was raised in Silver Spring, Maryland, and is a proud HBCU alumna, having graduated from Clark Atlanta University, my hometown, and Howard University College of Dentistry. Upon earning her dental degree, Dr. Spa received several awards for her academic achievements and leadership abilities and was inducted into Omicron Kappa Epsilon, OKU, Dental Honor Society. She then completed her residency at Howard University Orthodontic postgraduate program. With years of experience in private practice and as a former assistant clinical professor of orthodontics at Howard University, Dr. Spa is now the owner of Spa Orthodontics in Silver Spring, Maryland, and a leader in her field. She is the president of the Middle Atlantic Society of Orthodontics, MESO, M-A-S-O, hope I pronounced that correctly, and actively contributes to organized dentistry through membership in the American Dental Association, the American Association of Orthodontists, and as well a fellow of the International College of Dentists. Beyond her professional achievements, Dr. Spa is deeply involved in her community as a member of organizations such as Jack and Jill, Montgomery County, Maryland chapter, the Junior League of Washington, Alpha Kappa Alpha Sorority Incorporated, and with her church, Kingdom Fellowship AME. Dr. Spa also enjoys singing, hiking, spending time with her husband and two children. So without further ado, Dr. Spa, welcome so much. We're so proud of you, and I'm so glad you can join us this evening.
Thank you, Dr. Simpson. I'm so glad to be here and happy to share with our alumni community.
Awesome. Well, we're just going to keep this as loose as possible, as much as we just started in a very informal way. We're just going to ask you a few questions and feel free to elaborate as much as you want. We're not in technically no time limit, but if we can take 30 minutes or a little bit more of your time, we sure appreciate it, as we have appreciated you all this time. So I'm going to get started with a couple of questions that we're prepared for. What skills or qualities do you think are most important for success in your field? of orthodontics and dentistry in general?
Well, I mean, I think one of the main skills that you need to have, or I would say, I may say qualities as opposed to skills, but is to be service oriented, because we are in a service business. We, you know, we're healthcare providers as dental professionals, and so, our job really is to use our skills to help our patients achieve better oral health, and in my specialty, that means diagnosing and treating malocclusions, whether that is, a stems from a skeletal issue, a dental, or or a combination of the two, something that has to do with helping to a treatment that may have to do with helping to encourage growth in a patient, or an aesthetically pleasing smile. So I think that there are several ways to serve patients, but I think at the core, that's kind of that's kind of the main quality that you need to have. Flexibility, there are a lot of things that happen, that are going to happen throughout your career. And so I think that you need to be able to pivot, to be flexible, to be able to, determine if something isn't working, how to, kind of quickly move, to another plan or to the next step. And that really applies a lot to, practice, but also, to the business aspect of our field.
And I
Resilient.
noticed, oh, I'm sorry, go ahead.
Oh, sorry, go ahead.
No, I just noticed that as I was reading your bio, you have pivoted from, different aspects of your career, namely from, working at the school into now pivoting into your private practice, as well as we got to pivot every day dealing with patients' treatments, and, you might have thought it was going to go this way and now it's going to go that way. So pivoting is what we do
Right.
as dentists, but also, a lot of time, well, with patient care, but sometimes we don't do that with ourselves. So I saw that you're involved in a lot of different organizations, and I have pivoted a lot myself in 25 years of being a dentist in various ways, but we're not going to go there. But I do strongly agree with that. So kudos to you. And was there anything else that you was going to say on that before we go to the next question?
I was just gonna say, with pivoting, one of the things that I would like to encourage, especially those who, well, at any stage of your career, to kind of understand the landscape of our profession and what options there are, because, there's private practice, there's research, there's teaching, but there's also consulting. I used to consult to insurance companies, and so several dental professionals do this. That is something that I did part-time, but some people do it full-time. So that's something that a lot of people don't think about. There are a lot of different career options that dentists and dental specialists can pursue. And so I mean, we're going to get to a question to some other questions regarding, networking, but I think one of the things that I would encourage anybody to do is to network with other, with your colleagues, and just kind of to see what's out there, as if you're, especially if you're looking to maybe use your skills in a different way, or maybe you're having at different stages of life, you may need to use your skills in different ways. So, but I would say in terms of qualities, I said service-oriented, flexibility, resilience, really a love of learning because you're constantly learning in our field. Things are changing very rapidly these days. Lots of innovation, AI, and all kinds of new technology out there. And so, it's very important to kind of be up on what's going on, and also to be able to kind of discern between, what's trendy, what's here to stay, to not necessarily get shiny object syndrome. Just because something looks good doesn't necessarily mean it's sound, a sound product or something to use in your practice. Make sure that there's sufficient evidence behind you know, anything that you adopt in your practice. And so that's one of the things, just always learn, always, continue to do that because that's what's going to serve you really well.
Awesome. And like I say, pivoting, I find that if you don't again pivot into areas of our profession, you tend to get stagnant. And some of us might know dentists who have, been, I call them one-trick ponies, and they're good dentists, but they burn out faster, or they, and I feel if you don't pivot in certain ways outside of private practice or your office or clinical care also, and that's still staying within our profession. When those of us that do, we also are at more tables now, especially
Right.
whether it's legislative tables, whether it's community tables where we can make more decisions for our profession as well as our communities and stuff. So definitely fully agree with that. I think the next question was, how has mentorship, either as a mentee or a mentor, because we know you are a mentor, impacted your career?
Wow. So mentorship is very, very important to me. Because I was mentored. I mean, I feel like I was mentored into dentistry. So and I feel like I've had so many mentors, it will take me forever to name them all. But Dr. Cox, Dr. Cox and Dr. Anderson, were, two women who ushered me into the dental profession.
Awesome.
They really, it wasn't, at the time that I met them, I was actually a high school science teacher. So there you
Oh,
go.
wow.
Another pivot, because dentistry was actually a pivot for me.
Awesome.
I was a high school science teacher. They basically taught me about dentistry and what the benefits of being a dentist and the career path. Um, you know, you know the benefits of entrepreneurship, but also being able to have a service-oriented career, a meaningful career where you can help people, and also have financial benefits as well. And so, they really sort of, kind of guided me toward the field. And, they were teaching at Howard. And so that's kind of how I how I ended up applying to HUCD.
Awesome.
And, I mean, throughout my time in dental school, I've had, I would say almost all of the faculty I would consider to be mentors. Dr. Winfrey and Dr. Marshall, they were pretty big influences on me. They helped me actually start the ADIA student chapter back in, I think, 2008. or 7, 8, something around that time. And with one of my classmates. So we were the founders of that chapter, but with, the help of Dr. Marshall and Dr. Winfrey. I mean, all of the ortho faculty, throughout residency, and then of course, even as a faculty member myself, I felt as though I was mentored by, my former faculty, because I started teaching quite early on in my career, about 2 years after finishing residency. And then, as a mentor, I try to I've always tried to, I take that very seriously. I really try to consider, who I'm mentoring, whether that is a dental student or a resident, or maybe someone who is, an aspiring dental student, an aspiring dentist, an aspiring orthodontist, just, and even as a private practitioner, mentoring my patients, because, they're in your chair. Many of my patients are, adolescents. And so, while they're there, you don't just have influence over their oral health and their smile, but you also, you're there to inspire them, so I talk to them about, what's going on at school and what their aspirations are in terms of career or college. And for, many kids, sometimes those conversations aren't happening at home. And so it's something that I feel very strongly, that we, as, healthcare professionals, we may be the ones to give that first little nugget of, hey, you can have a career similar to what I'm doing. Or, you can be a healthcare professional. You can, go to college, you can go to grad school, giving them giving them, you know, inspiration to know that they can do whatever they want to do. And in terms of, dental students and residents, giving advice, but also, as a faculty member, holding people accountable,
Right,
making
right.
sure that they know what is expected of them, but also really leading them with compassion, because um, you know, sometimes, you know, students may have a lot going on. And in my experience, just trying to look at the whole picture and try to meet them where they are. I think and everybody's mentorship style is different. And so that's
Definitely.
sort of my mentorship style. The other thing is, there's like a difference between mentorship and sponsorship. And so for those who I may have been able to get to know pretty well, then you kind of stick your neck out a little bit more, and you may actually try to help and provide opportunities for people, make phone calls, really, make sure that they are, that you literally put them on a path to achieve whatever opportunity they're looking for.
Right.
So that's something that's, those are things that I really enjoy. I enjoy the opportunity of being a mentor, because I feel as though I've gained so much from being mentored, and I'm still mentored, even this far out in my career, I still have mentors that I rely on for, you know, advice about various things. So it's, it's ongoing. Like I said, learning, the learning continues.
Well, I mean, definitely. And I guess the word for the interview for us now is pivot, because your pivoting has got you to where you at, and it's also got you to helping so many other people. So, Kimmy, the key word today for this interview is pivot, okay? Because it's awesome that you've been doing all of what you're doing, Doc. And speaking of Dr. Anderson, who I love, and Dr. Georgetta Manning Cox, awesome ladies. God, I miss them. I miss a lot of my professors too. And I hold all my professors in high esteem. Matter of fact, Dr. Brian Lawrence, everybody was calling him Brian. I can't call him. Just spoke to him last week. He's still doing awesome research at school, but I still can't call people my professors. I don't care if he's my first grade teacher or my dental school teacher. I can't call you by your first name. Even though he's in my generation. Last week I said, hey, Dr. Lawrence, Dr. Lawrence, Dr. Lawrence, you know what I'm saying? Because they mentored me, you know what I'm saying? And they still mentor me 25 years later. You know what I mean? I would dare. This is like, I ain't gonna call my mama by her first name. I'm not gonna call my professors or my teachers by their name, because I hold them in such high regards for making me, a lot of who I am today. So kudos to that. And Dr. Anderson and Dr. Georgetta Manning Cox, all of them. And as far as networking, speaking of that, obviously we see how you networking with some of those professors pre-dental school has influenced your career. But in what ways can alumni, since you are alumni now, support one another professionally and personally, and the networking opportunities? How has that influenced you also?
Well, one thing I can say is that most of the job opportunities that I have come across have been as a result of relationships I've built with colleagues.
Okay.
Someone will call and say, or send me an email or text and say, hey, do you know anybody looking for, this opportunity or that opportunity? And, happens to be the time when I'm looking for something, or I'll reach out and say, hey, do you know anybody looking for this or looking for that? Is someone looking for an associate when I was looking for associate positions? Um, you know, um, faculty, I mean, being faculty, when I was in dental school, I mean, I think a lot of the faculty knew that I wanted to teach, because I talked about it a lot, and I did. And so that was always sort of something that I was going to prepare to do early on. And so, again, um, that was something where, speaking to the faculty and telling them, remember, I said I wanted to teach, and applied, and came back and fulfilled that position. When I mentioned about the consulting position that I had with one of the insurance companies, I just had my daughter, so this was in 2014, and I was teaching. So I was teaching part-time, and I was doing very little private practice at that time, maybe one day a week. And my classmate sent me a text and said, congratulations, I know you just had a baby. Would you be interested in consulting with an insurance company? I had never thought about it before. It came out of nowhere. And, because of her taking the initiative to ask the question and present the opportunity, I followed through and, did that for a little while. So that building those relationships, maintaining relationships, it's hard because we get so busy. I think it doesn't have to be an everyday thing. I mean, most people understand if you're not, calling them every week. because everybody's busy. But I think that, um, you know, at least, establishing and maintaining, positive relationships with your colleagues can go a long way. And people will, think of you when opportunities come up. They will, if you reach out about opportunities, they'll feel comfortable recommending you. So I think that's the key. It's building the positive relationships. Also in terms of networking, and when it comes to leadership, a lot of times the leadership positions come about because of a nominating committee, and someone may have worked with you, in another setting, and they will recommend or nominate you for a position based on, certain skills or certain qualities that they see in you, to further the organization. So when it comes to, yeah, some of the leadership positions I've been in, that's another, a lot of times before you're elected, the nominating committee will kind of start thinking of, well, who do we want to consider? And your name may come up because of the relationships that you've built. And it's not just the person that knows you and likes you, but it's what they've seen when they've worked with you. Do they think you're reliable? Do they think you're going to be a hard worker? Do they think you're going to be someone who will lend a voice to the organization and to further the mission, and also keeping, making sure that member concerns, are top of mind, so that, you're there for that purpose.
Okay. Cool.
So I know that was like, I know I went way off on a tangent, but
Well, this is what we need to know. Because a lot of times it might be one or two sentences that make somebody and then somebody. Oh, trust me, now we good, you good.
and
And
I'm sorry, can I add something?
Sure.
I know people think about networking as like, okay, that means I have to like go somewhere, go out, go to an event, talk to people, but yes, that's one way. But also, like I said, it's sort of like those little interactions that you have with people day to day, working with people and, in various um jobs or organizations, or even when you're in school, dental students, don't burn bridges. Make sure that you, um, you know, are, just build positive relationships and try to, maintain them as best you can. But there are a lot of different ways that you can network outside of, just sort of going somewhere and shaking hands. You have social media. You can reach out to people if you know people. If you see someone talking, someone speaking, doing a lecture, a lot of times people are very, very open to you reaching out to them. So, sending somebody a DM on Instagram or Facebook Messenger. I do this a lot when I have a question. And if I, or if like I've planned meetings and I needed someone to speak. And so I didn't have any other contact information for the person, but I could, find them on social media. So there are a lot of different ways to network. Don't necessarily think of things just being like a traditional event. You can always one-on-one. You can ask somebody if they wouldn't mind meeting you, maybe coming to visit their office, especially, if you're a student or resident, kind of aspiring to, maybe do a specialty or to, go into private practice and you want to visit, that's another way of networking. So long answer to get to the point of the question, but yes, networking is great and it's influenced me quite a bit. So yes.
Awesome, awesome. And I think something's in your bio, but kind of elaborate briefly on how do you say update on advancement innovation in ortho?
Oh, how do I stay updated on the innovation?
With updated on the advancements and innovations in your field, ortho.
Okay. A lot of how I stay up to date would probably be CE. There are a lot of different there are of course the larger meetings, like in my field, the American Association of Orthodontists has the AAO meeting. So that's one that's our big meeting every year. But if aside from that, there are several meetings. I mean, now there's tons of not only meetings, but then there are courses. So, you can take courses, that are specifically geared to maybe something that you want to learn that's maybe even like something that you want to subspecialize in your field that you want to kind of just, hone in on. And so you can take courses specifically geared to things that you want to learn, but also, again, I think networking as well, like talking to colleagues. So a lot of the colleagues, the ortho colleagues that I'm really close with, we share a lot of ideas. We talk about, what we're doing in our practices clinically. Are you using this? Are you using that? Are you using this technology? How do you like it? Has it been useful for you? And then, taking that information and also, reading articles and seeing what's out there in terms of, the body of literature, to make sure that you feel comfortable in terms of the evidence that's presented. Because that's really important. I talked a little bit about shiny object syndrome, because there's so much now, right? There's so many forms of technology and things that you can adopt into your practice. But what things are solid? What things are going to be are going to enhance your ability to, give your patients the outcomes that you would be proud of and that they are looking for.
Gotcha.
What things will maybe enhance your efficiency when you're practicing. So I think, and this is just a little note, because a lot of times you'll talk to the sales reps, and um, the sales reps will give you, all the great information about certain products or certain treatment modalities, and that's their job. But you have to kind of do your own research. And part of that research is talking to your colleagues. Part of that research is, doing your, reading and going to courses. I think I saw a question. Hi, Chanel. Not so when I said subspecialties, I didn't mean it necessarily. What I meant was, there's no official subspecialty for ortho. It's just, if like some people really kind of focus in on like Invisalign. Some people focus in on, airway. Some people focus in on, using TADs. So some people, when it comes to doing ortho, they're going to kind of just, um, they're going to focus on a certain aspect of uh, treatment and kind of use that for their practice. That's what I was referring to.
Okay, cool. What, how have you used your skills in ortho dentistry to give back to your community?
Well, one of the things I remember, I haven't volunteered in the Colgate van in a while, but I used to do that quite a bit. And you know, I would volunteer, you know, they would bring the Colgate van to various neighborhood schools. And so I would, you know, do dental screenings, and then within that, I would do ortho screenings as well. Um, and then what I started doing is for different organizations, that I was a part of, I would try to connect the Colgate fan with those organizations when we were planning like a health fair or a health event. And so, you know, just kind of because I am always thinking about how we can increase access to care. Um, so, you know, doing a lot of I think being able to get out there in the community and just educate people about oral health. That's one of the things that that I do enjoy doing. So, you know, if there is um, if there's a health fair, if there are even just like health talks, you know, that are like small group talks for community organizations, I enjoy doing that because a lot of times, you know, people just need general knowledge about oral health, you know, and then of course I will incorporate orthodontics into that, but sometimes people just need the basics first. And I'm always happy to, you know, lend my knowledge because I think that there are a lot of people who unfortunately neglect their oral health because they don't have the, you know, they don't have the proper information, or they think they don't have the resources, but maybe they don't know how to get the resources they need to take care of their oral health. So I've seen, I've I've witnessed a lot of good coming from that, so I continue to do it. Um, you know, the other thing, I mean, in my practice, like I said, you know, kind of mentoring, using my practice as sort of like a secondary teaching facility, I would say. So not officially, but you know, people will reach out to me, high school students and college students and even dental students, you know, that are interested in ortho. They want to come and shadow and you know, learn about orthodontics and what I'm doing. I'm always willing to do that. So I think that's one of the things that, you know, is important because it helps to shape the next, you know, the next generation of dentists, of, you know, of people that even if they don't go on to become dentists or oral health professionals, you know, at least just being able to see, um, you know, that healthcare may be a path for them because truly we do need more minority health professionals. And you know, I know there are a lot of wonderful organizations that are actively helping to um, increase those numbers, and they're doing a wonderful job. And so, you know, I'm doing, you know, my part in my little practice to try to help with.
Definitely,
Yeah.
definitely. Hey, we all, every little bit helps. Each one reach one. For those who want to start their own practice, especially in ortho, what is the biggest lesson that you learned early on?
Well, I'm still new at this. So, the biggest lesson is probably just like anything in life, business is dynamic. Um, things are changing. And so, especially in the beginning, it's important to stay grounded because there are a lot of ups and downs. Um, you're growing the business and you are also, taking care of people, right? And you're taking care of your patients, you're taking care of your team. You have a lot of different hats to wear.
Right.
And so with that, um, it's important to recognize that, things won't be steady state. Things also won't kind of just like steadily go up. There's a wave. There are going to be ebbs and flows, and that's normal. But to also, like I said, keep in mind that, at the end of the day, you need to have solid ground, in terms of, your thinking, your um, kind of your mental health, and making sure that you are focused and disciplined in the way that you are, pursuing this practice dream that you have. Because there are, like I said before, a lot of options, a lot of things, you know, a lot of different things that you can get distracted by, I would say.
Mhm.
A lot of different marketing things, a lot of different, you know, types of technology that you can adopt in your office. But I think that, you know, having a plan, knowing that the plan may not work out exactly the way you want it, and, pivoting, like I said before, you know, being able to pivot and be flexible and resilient, bounce back, move on. Very important in private practice, and especially in the beginning of starting a practice.
Awesome, awesome. How has advances in technology influenced your approach to ortho since you graduated?
Well, when I was in residency, um, we were just starting to use Invisalign, like just just starting. It was out, people were using it. The technology wasn't nearly as advanced as it is now. And frankly, there weren't really that many other like clear aligner options. Um, and of course now, and this kind of goes to a question, in the chat, there are lots of clear aligner options. And a lot of a lot of that, a lot of the use of clear aligners has also, increased. And there are, I would say, probably like five or six that most orthodontists use, but there are so many out there, and so many innovations in that technology. Now, AI is kind of being incorporated into, um, you know, all of the digital treatment options. When I was in school, digital digital treatment options weren't, there were sort of being developed, but but now there are many. And what I mean by that is being able to um, being able to move teeth, you know, on the computer, to move teeth digitally, to be able to see exactly where you're moving teeth, and if you have like a CBCT, you can see, you know, root movements, crown movements. You're able to very specifically customized treatment. So the way that you can customize treatment with aligners, you can also do that with some systems of lingual braces, and then also labial braces too, just traditional metal braces, and also, you know, ceramic braces. So there are a lot of digital options, which that is definitely something that's definitely something that's changed since residency. And I think that more of that is going to be on the horizon.
Have you found any tools or systems particularly helpful for keeping you organized?
Yes. So, like I said, you know, when I think one of the things in my practice that, you know, that really helps me, because I'm someone who likes to have things, have everything have a place, right? So so if you know, I've kind of designed things so that we have, in each room we have everything that we need. And we're still sort of developing, because every few weeks I say, well, oh, maybe we can actually, you know, try to transition this from the back to the room, you know, so that we don't have to go back and forth a lot. So for instance, like I buy a lot of little containers, and maybe I'll get them on Amazon or Container Store, so that each, I mean, from the teeniest thing in the office, each thing has a place, and you know where it is, so that you don't have to look for it or find it. It keeps it this sort of system of organization um, allows for um, continuity, like when you're training, because people, you know, people can see it. Also, it's also very visual. So like I have my wires in almost like this container with multiple drawers, small drawers. It's really made for like cosmetics, but we've labeled them, and it makes it really easy because it's also visual inventory. And so you can see when you need to, you know, what's getting low, when you need to order something. But it also just keeps people, um, it keeps us organized, and it keeps everybody kind of on the same page in terms of like knowing where things are. Um, I would say also just you know, in terms of like trying to make sure that we just have like written protocols for everything, because that also keeps people on the same page. But that's also something that is evolving, because you may decide, hey, you know, I'm doing something one way, I may want to change it. And that's okay. And like these protocols are going to be working documents that you're gonna have to modify as you innovate, as you grow, and you know, as new ideas come. And I think that's also that flexibility piece that I mentioned, like to be able to um, say, I have this system, this is the way we're doing it, but you know, hey, one of my team members has an idea. I have an idea, should we implement this? And if we can, let's do it, instead of saying, this is the way we've always done it. We're gonna stay, and we're gonna stay this way. Now, of course, there is value in, like I said, you know, being consistent and kind of having, not changing with the wind. But if there is a way to kind of like overall make things better, then I think that it's okay to tweak your system, because it may be working. Systems are also dynamic, because systems may work for what you're doing now, but that system may need to evolve based on how you grow and what you're implementing in your practice. So, and who's working in your practice.
Well, and I mean, definitely, as far as, all of that is, again, pivoting. You have to sometimes see what works, and if it's not working, or to tweak it, you have to, as our favorite word for this interview is, pivot, and we all do it in our practices also, because it helps not only you stay organized, the staff, and keeps the flow more improved. So what advice do you give aspiring dentists looking to make an impact in the dental field?
Well, I would say, if you are, so we're talking about like high school and college students, or are we talking
Mhm.
about, okay. Aspiring dental students, and also, I guess I'm assuming dental students as well.
Right,
Um,
right. An aspiring dentist, yes. Mhm.
okay. So, um, I would say, one, make sure that you do seek out mentors. And when
Mhm.
you're seeking mentorship, um, you probably should define what you're what you would like a mentor to do. Okay, what you're expecting of a mentor, because everybody doesn't mentor the same. And so you want to be clear about your expectations of a mentor, but also you need to also understand what may be expected of you as a mentee. Okay. Because if you are if you have a mentee mentor relationship, um you you may want someone to give you advice, maybe to help you to secure an opportunity, or to allow you to come and shadow in their office. But on the flip side, the mentor may expect for you to um, they may give you assignments. So they may say, okay, well, bring me your resume. I want you to tweak this and this by this date.
Mhm.
Um, you know, I have a few contacts that I would like for you to reach out to. Um, you know, please do it by this date. And so I think that sometimes people make the mistake as a mentee, not following through. And then if you have the sort of relationship where someone is sticking their neck out for you, they may
Mhm.
not
Mhm.
they may not feel so inclined to continue to do that if you are not
Mhm.
doing your part. um
True.
so So I want you to consider that when you enter the relationship, again, when you enter a mentor-mentee relationship, to know what's expected of you, and also to know what you expect of the mentor. Because some people you may be expecting someone to give you advice, and maybe their way of mentoring is just that you watch them work, right? So maybe they're not going to be as verbal with you, but they'll, they just kind of want you to see what they do all day. Maybe there's someone who maybe there's someone who is willing to sit down with you and give you things to do that they feel are going to benefit you in the long run. But maybe you are maybe you don't have the at that time, maybe you are not able to make the commitment to do those things. So I think it's very important to be clear about what the relationship looks like, but also, to seek the mentors that you um, feel will meet those expectations and that you can meet their expectations. Um, I I think the other thing is, yeah, just, you know, I would say do a lot of shadowing.
Mhm.
Do a lot of shadowing, do a lot of, don't necessarily pigeonhole yourself, because some people say, well, I'm an aspiring dentist and I want to be an orthodontist. Well, I would encourage you to look at all the specialties. I would encourage you to explore, as opposed to just saying, this is exactly because you might be right, and maybe that's a good way to kind of like rule out everything else and to confirm your decision. But you also may discover that you have an interest in something that you never imagined that you would. And
Mhm.
so if you take the time to do this, I would, um, you know, yeah, I would definitely encourage you to take the time to do it. If you do, make sure to reach out to people. If you're a dental student, you have professors that you've connected with, hopefully, and maybe either they have practices where you can shadow, or they will have, friends and colleagues that they can kind of refer you to. If you are high school or college, I would start with, some of your mentors and ask them, who they may recommend in different specialties. But it's, sometimes you may think that one specialty is, you know, what you may think that you want to pursue a specialty, and then if you shadow enough, you may realize, oh, that's not actually like what they're actually doing is not what I actually thought that they did, or vice versa. This is great. This is much more in line with, what I was, was thinking and interested in pursuing than I thought. So, um, yeah, I would definitely encourage you to shadow, and shadow actively. Make sure that you're looking for, during while the doctor is doing procedures, you don't necessarily need to be asking questions, but be thinking about questions that you want to ask, um, when you all have time to talk, because
Mhm.
otherwise you're going to be kind of just, standing there. And,
Right.
the learning a lot of times happens in the discussion. It's what you're looking at, but a lot of times you don't know what you're looking at until you have the discussion, because, this this isn't your field yet. So,
Right. Right. Well, and this is my last question before we go into any questions in this chat. And sure, been a great interview here. If you could give one piece of advice to someone graduating dental school this year, what would it be?
okay. Well, those who are graduating dental school this year, I would say
You know what, Doc? Let me interrupt you
one
there.
piece.
not say dental school. Let's say, I mean, I know you're a dentist first, but let's reroute that to ortho
Okay.
graduate, because I know that's more of what you have full experience with.
Okay. Well, let's see, about this time, let's see, they're studying for boards, probably about to take their boards very soon. Make sure that you and some people may have job opportunities and some do not. When it comes
Mhm.
to looking for jobs, consider what I said in the beginning. You know, use your network. Okay, use the relationships that you have built, um, to uh, to see, if those colleagues or friends may have opportunities that they know about. Okay, ask,
Mhm.
ask questions, ask, um, ask your professors and, um, even the residents that have graduated, maybe like your big sibs and those who graduated a few years ahead of you. They are usually, a wealth of knowledge. The supply reps are also really good at
Mhm.
knowing who may be looking for opportunities. I've seen people, sort of do the, like, I guess, firing squad method, where you kind of, just you find the place where you want to go, and then you send out, cover letter and resume to everybody. And that's, I mean, that's valuable too, because you never know what can come of that. Um, I would say when it comes to selecting where you want to go, um, you may want to, I know for a lot of people, it's finding a place. A lot of people are kind of finding a place where they think they're going to get everything. I want a place where I'm going to be happy, where I love, the area, where I'm going to have a lot of, um, I guess, a lot of other opportunities outside of work. But I think that you should consider a couple of things when you're looking for jobs. Um, One, sometimes you may, if you are interested in, and I know a lot of times residents are interested in mentorship when it comes to
Mhm.
job opportunities. Um, and this is hard because I know student loans are high. Um, but sometimes you may want to consider, um, if you are able to, taking a little bit less for an opportunity that may benefit you greater in the future. So if there is an opportunity um, for mentorship, in a practice, and you know that's um, pretty, you're pretty sure that's what the opportunity is going to be like, especially if it's with, maybe it's someone that you're taking over for, a colleague that's leaving the position, and they've said, this is a good opportunity. There's, mentorship opportunity here, et cetera, et cetera. It may be something worthwhile to consider, even if it's not, um, as financially rewarding as another opportunity that doesn't have that mentorship component. Um, but, you know, that's my advice. I also understand, that
Mhm.
many of the ortho residents have quite, high loans. And so they have to consider that too. So keeping that in mind, at least make sure that you establish some sort of, you know, have a group of colleagues that you can talk to
Right.
when you finish, and also have a group, have, maybe 1, 2, 3 mentors that you can, I would say, people that you can call on, when you have questions, um, because, you're going to need that when you first get out.
Okay. Right. When very, very, but would you say to find that opportunity that might be better for you is, would you think more of do you think corporate situations are mentorable? Man, if that's such a
It
word, or
depends. It depends. I think that if it it some with some corporations, they do have mentorship structure.
okay.
Like they may have, there may be, you know, two two doctors kind of working in the same office. There may be like a network of orthodontists that work for the same corporation, and the corporation sort of fosters, um, the mentorship, between the younger doctors and the more experienced doctors. Um, with those situations, I would advise talking to the people that have worked there, and the people that have, maybe those who are, um, uh, that you may that may end up serving as mentors, to see if that's kind of, if the if you will have that sort of, um, situation when you actually get the position. Um, and that way you're just kind of like clear on what to expect. And if everything may not be, perfect in the way that it may not be, a full mentee mentor experience where you just have, lots and lots of time to connect and review cases. And but if maybe there is, some time that, you can do it during lunch, or you can do it, after work. Um, it may not be, it may not always kind of fit in, the way that you think it should. But if the opportunity is there, and you are able to at least, um, have a resource, um, to kind of fulfill that need, then I would say it's possible. But this is where the asking questions and having having a network, it kind of almost goes back to that again.
Definitely.
Asking questions of people that you trust, that may work for that corporation, and also, you know, having the relationships with people in your network, um, that can give you advice about if the opportunity is going to be what you expect or not.
Cool, cool, cool. Well, Doc, I definitely appreciate. I'm open it up. Dr. Kimmy, are there any questions before we end this wonderful interview by chance? I know there was a couple that you answered already, Doc, but just want to make sure to see were there any in the chat, or open it up for any questions here.
Yes, I think there was a question from Dr. Small, and she asked the question, what are the preferred clear aligners amongst orthodontists?
So, like I said, there are, right now there are kind of several systems that, a lot of people are working with. Invisalign is one. Spark is another. So Spark is the Ormco clear aligner system. Um, Solventum, which is formerly 3M. They have a pretty popular clear aligner system. Angel Aligner is also a company that is on the rise, and they are, I think at this point, they pretty much work with orthodontists. But there are actually several, there are a lot, because I one thing I will tell you is that a, a lot of the labs that are out there have their own aligner systems. So there are the big ones, so Invisalign and Spark and Solventum, and then Angel is kind of getting up there. But then, there are, ortho labs that have also developed their, clear aligners. I know Sure Smile was what, they had kind of transitioned from doing um, the wires, the robot bent wires, to kind of going to the clear aligner realm. But I think and so I'm not sure if they're still as popular, but I know people do use Sure Smile. But yes, a lot of the labs and some of now I think actually some of the larger supply companies have their own clear aligners. So there are a lot of options. But yeah, I think the four that I mentioned are probably the ones that most of us use. I hope that answered your question.
Uh,
If anybody
what's up?
has any questions, please feel free to unmute yourself to ask them. It's a safe space. We listen, we don't judge.
That's right.
Yes, no question is too crazy. This is definitely a platform where we're going to use to not only just bring different aspects of dentistry, but also give people an opportunity to say, you know what, maybe I want to be a GP for the rest of my life, my dental career, or maybe I want to pivot, or maybe I'm already a specialist. I want to tack something else on. So this is definitely this is what I envision this platform to be.
Can I add something too? I didn't really get into much about organized dentistry, but I think one thing that um, a lot of people, especially younger dentists and orthodontists, um, you know, have told me is that they don't feel like they have the time to contribute to, um, organized dentistry. And one of the things that is really important, because I've been kind of involved, since dental school, but definitely a lot more heavily involved in the last, well, yeah, probably, yeah, since dental school, I've been pretty involved in some organization, one or two at a time. And um, I will say that, not every position requires as much time as you think. But sometimes really small positions that don't require a lot of time have huge impact. And your voice matters. And so if you are asked to be a part of a committee or serve on a board, the first question, especially if you're concerned about your time, if you, have other obligations, if you, if you have a busy job, other time commitments, family time commitments, if you have, other things that you're pursuing outside of dentistry, trying to incorporate a little bit of organized dentistry can go a long way because, and especially for minority dentists, because a lot of us are not involved in many of, the larger organizations. And, they need to hear our voices and many times appreciate hearing our voices and don't understand, haven't had the opportunity to understand some of the needs of minority dentists. And so if somebody asks or requests, or nominates you to be on a committee, or to be on a board, the first question you can always ask is, well, what is the time commitment and what does it entail? Instead of just saying no. Now, if you know that you don't, once you ask that question and you know that you don't have the time, obviously don't feel pressured. But sometimes when you find out, oh, it's just, two meetings a year on Zoom or something like that, maybe it will change your mind in terms of what you're able to contribute. Now, of course, the more you get, the more involved you are, and as you become probably more like an officer, and take on larger roles, the time commitment becomes larger. But I will also say that for many organizations, if you're in long enough, you kind of start small and you build. So by the time you get to, like, I was on the MESO board, I started in 2017. And, I've built, through the years, the time commitment has increased as I've been on the board, more so when I became an officer. But you kind of learn how things operate being on the board for a certain amount of time. And then once you get to the point where you're the president, you kind of, even though, yes, there are things that come up that you still have questions about, and you have to still rely on mentors and your, your colleagues, but you know what to do because you've been around. And if you're someone who is looking at, things that are going on in your organization, and you're saying, well, how come, why aren't they doing this? Or why isn't this happening? Or, I think that they need to implement this or that. You're probably somebody that would be a great candidate for, a board member, a committee member, a delegate, someone who can lend a voice, because a lot of people probably have the same questions and may not be speaking up, or may not feel like they can speak up. And I think that it's important for us to lend our perspective, because in the end, it's all for the greater good. Like, we'll all benefit from those who contribute and speak up. So I would say, please consider getting involved in some small way, and lending your voice to an organized dental organization.
Sweet.
Definitely agree.
We got one from our lovely administrator, the Tiffany Gatson. And she asked the question, do you feel that your experience as a teacher has helped in the way that you mentor and practice Before you answer that, anybody can get off mute and ask these questions. Please feel free, but yes, that's the question.
Yes. Because I still consider myself a teacher. So I mean, in terms of the way that I train my team, I train them like I'm teaching them. So, the way that I used to teach residents, um, in the clinic, if, we're doing a procedure and I want, other people to see it, they'll come over and watch. I kind of still do that, in the practice. I will talk to them and ask, this is something, um, I will ask them, is this how the other thing that I do is I ask them, about like how they learn best, because I want to make sure that I'm hitting, um, you know, a using a learning modality that works best for them. And so when I was teaching, in some way I would do that too. It's a little bit, when you have more students or with residents, it's a little bit more challenging because you have more people you're teaching. But, sometimes people need to learn in different ways. So if what I'm doing is not, um, resonating, or they're not able to learn the information, we'll try something else. And that's something that I've kind of, I did, at that time. And then I'm doing it now. Yeah, I think that just kind of, um, when people need, I remember residents and dental students would come to my office just for advice about, career and, just, you know, dentistry in general. Like what, um, or even questions about, kind of like life, like balancing, your life, balancing, um, how do you keep yourself grounded and do, certain things within your career. And, you know, sometimes my team members ask that too. But one thing I will say is, you know, as a faculty member, I learned a lot from my students and residents, and I also learn a lot from my team. So I think having that perspective, like, I don't know it all, really. I carry that in both settings.
Cool, cool.
Yes. Does anybody
Did
else have
anybody else?
anybody
Anybody
else?
else have any? Oh, go ahead, Kimmy.
Sorry. Does anybody else have any questions?
I don't have a question. I just wanted to say thank you to Dr. Augustus. I was a student of hers. I graduated from ortho in 2021. And Dr. Augustus has been absolutely pivotal in my career. I mean, from the absolute beginning. She helped facilitate my visit to Howard as a dental student when I was considering Howard for residency. She helped me get my first job in my career and even, spearheaded some of just the thoughts of ownership when she invited me to her office when wasn't even spa ortho at the time. So I am just seeing that Dr. Augustus isn't just speaking, she is truly everything that she has said on this call. She walks in it truly because what she has said, to do just in terms of mentorship and, networking and things of that nature, she's literally done for me in some way, shape, or form. So I just wanted to say thank you. I think it's important to give those flowers while they're still here. So thank you so much. You have been absolutely pivotal in my career. And I just look forward to seeing all that you continue to do in the various roles that you play. So thank you.
I'm sorry, Doc. And who are you?
Yes, please introduce yourself. We want to see
Sorry.
Bison. Let's go, Bison.
So, my name is Lisa Quatten. I graduated from Howard Ortho in 2021.
Awesome. Welcome, Doc. Thank you
Welcome.
Thank
so
you.
much.
Thank you, Dr. Quatten. Yes, I'm very touched to hear that. Yeah, every time that's one of the things I'm very proud of you, and I'm very proud of all of those who I've taught and mentored. When I see them growing and learning and out there just doing their thing, it makes me I'm just I feel like, just being able to even just have a teeny little, you know, bit of influence, there is just it's so gratifying. And that's one of the things that I loved about teaching. Love that. So I'm so happy you're
Awesome.
here. And
Yeah, I say I'm not going to cry tonight. You almost got me.
I
You
know.
almost got me.
Yeah.
These are the moments that make being a part of HUCDAA so critical. Knowing that you're able to have this platform to be able to not only just give flowers, but hear from the next, I think Dr. K may be the next MESO president. Who knows? But just getting this platform and having
Oh,
an opportunity to say, you know what, if this person was able to triumph or had any trials and tribulations they were able to overcome, or had some tidbits that would help them in their practice or just in life. That's what I
Mhm.
want this platform to be. And I'm so appreciative of you, Sana, for coming on board. Thank you, thank you, thank you so much. This is a lot. I learned a lot. I learned a lot for sure.
Big time. Big time. And Dr. Lisa, please stay tuned and get involved with us. We would love to share your experiences also, but we surely appreciate your touching flowers testimony tonight. Hope it's not the last time that we hear from you.
Absolutely. Thank you for creating this platform.
Thank you.
Well, thank you for being here.
and can I say one more thing? I don't want to
Sure,
take forever,
sure.
but Dr. Small is on here, Chanel, and I mean, when you think about people that have had influence, she was one of the occlusion tutors when I was, or maybe you were the occlusion tutor when we were in dental school. And I learned so much from you. You were so great at teaching. I remember my first year of dental school. I remember someone asked me, like, what is the hardest class that you had? Like, which class do you think is the hardest? And I was like, occlusion. And they were like, not biochem, not anatomy. And I was like, no. And I was like, because, I have a science background. So I was good with those courses, but dentistry, like I told you before, Dr. Cox and Dr. Anderson kind of ushered me into the field. I didn't really know anything about occlusion and like technically, you know. So when I was, just learning the terminology, all of that was like a new language for me. And, going to your sessions were, life changing because that's you go to class and then you go to our study group. We would go to class and we would go to tutoring, and that's where and I think you did tutoring on Saturdays too, if I remember. But all I know is very helpful, and
Glad to help.
I did well in occlusion because of you.
I'm not crying tonight, y'all. I will not do it. I am not crying. You guys are hitting me in the feels. This is so awesome.
Exactly. Dr. Small, you there?
I'm here.
Oh, hey,
Oh, is that the
Frank.
baby? Oh my God, you just tell her to kiss the baby. Uh awesome. What do you have to say, Dr. Small? Because I know you have been very pivotal in a lot of our lives.
I'm happy to be here and take it in. I'm happy to hear Sana. I always thought she was fantastic.
I am happy that we are continuing this program and these interviews.
But did you know that you were pivotal?
I didn't know
That's
pivotal. No, I didn't know pivotal. No, I didn't know that.
That's the key word. Kimmy, put that on Dr. Augustus's video. Pivotal, pivot. But in occlusion, did you even know that,
So
Dr. Small?
no, I didn't. And I remember we talked about the alligator, and I know how occlusion can be just a second language when you first learn about it. So glad
See,
to help.
it's the little things that are huge. You know, you didn't even know that you influenced Dr. Augustus, from my understanding, but that's what we're all about. You know, I know other schools have their, you know, blessings and high points too, but we're talking about Howard. And if it wasn't for Howard, most of us on this phone call wouldn't be where we at. So, you know, it's just like you say, it's just touching to know, you know, all the and I can't hear enough of these stories. No matter how many I hear, it never gets old for me. So, and I just want us to continue to do what we're doing, which we're doing anyway, and just continue giving each other flowers, you know, and that's what we're all here about. So, you know, so hats off to all of y'all, but definitely you, Dr. Augustus. Is there anybody else? I don't want to cut this, I'm not cutting this short or nothing, but is there anybody else that has any words or questions or words of encouragement for Dr. Augustus?
Going once, going twice. We are
Well, if
so
all hearts and minds are clear.